Welcome back. Now, today is National Wear Red Day to raise awareness about the #1 killer here in the United States, cardiovascular disease. The American Red Cross is hoping more people join in on the nation of lifesavers. I'm kind of part of it. So being part of a lifesaver is definitely learning hands-on CPR. And so this afternoon we have with us Jordan from Nationwide Children's Toledo Athletic Trainer. Now, tell me, who's this?
So this is our mannequin. This will be our patient for today.
Okay.
One of the first things people normally want to know is, how do I know somebody's in cardiac arrest, right? So we do what's called look, listen, feel. It's just a quick check. So we're going to listen for breath, check to see if their chest is rising, and check for a pulse. If none of those are present, 5 seconds, right? Really quick check.
Okay.
You know they're in cardiac arrest. So would you like to learn how to do hands only?
What do I do now? Okay,
Perfect.
he's down.
All right,
she's down.
So we know they're down, right? We know that we need to help them.
Yes.
So we've looked, listened, and feel. We've determined they're not okay, right? The first thing we want to do is call 911 because you want to make sure emergency services get here. Okay. If we don't call anybody, we're going to be stuck doing this for a really long time. So again, which is awesome. We can do it, but
yeah, but help would be necessary.
Exactly.
Okay.
So after we call 911, we're going to go right into compressions. So what we do is we're going to use this hard part of our hand right here, okay, just because it's nice and firm. You're going to lock your fingers so you have a really good pushing point. You're going to come on the side of the patient, lock your arms out, and we're pushing straight down on the middle of the chest. So with these guys, okay, luckily they'll show you. On a person, you're looking at the sternum, which is that kind of bony part in the middle of your chest.
Okay.
Same for men and women. It does not change. So once we get in our position, right, and we're pushing straight down, okay, so make sure arms are locked out, and we're pushing straight down, you're gonna go to 100 to 120 beats per minute. And you keep going, keep going, keep going, keep going, okay?
Oh, God. Okay.
And the goal is to push hard and fast.
Okay.
Now, if you want to keep a rhythm, staying alive is a great one. Okay, that's the one we love to do, right? The only time you would stop is if they come awake, so they're alert, it worked, you saved them. If emergency services get there and they're ready to take over for you, or if you're getting really tired, hopefully somebody else knows and you can trade out.
Now, when it comes to this, because I imagine this would be honestly a frightening experience. Someone goes down and the first thing everyone does sometimes is just freeze. Is it right for me as a non-medical professional to immediately take charge?
100%. Anybody can jump in. So the nice thing is even as young as 9 years old can learn how to do CPR. So we see people, even like children, 32,000 cases a year outside a hospital go in cardiac arrest. We want everybody to know, at least one person per household, how to do hands-only CPR, because doing it and jumping in and not being afraid to, step in and say, hey, I can help, doubles and triples their chance of survival.
Now, when it comes to movies, TV, the excitement of, not news, but we're exciting in our own right. But no, I see it, they always do the compressions and then they immediately stick their mouth on it. Like, do I have to do mouth as well as chest compressions?
You don't.
Okay.
So the new standard for bystanders, right? Just give good compressions, hard, fast compressions. So being able to get that blood out to the organs, okay, and creating that, same circulation, you are going to do far more better for them than if you were to stop and try to give breaths, especially if you're not, comfortable with it or you're not sure how to do it. That's why something as simple as hands-only CPR and seeing how to just do that motion, you're gonna, again, 2 to 3 times improvement in whether or not they survive outside of the hospital.
But what if I break them? I'm afraid I might break the person.
So that can happen. Okay. It's not unrealistic, but there are Good Samaritan laws that would protect you, that because you were trying to save, like a life over limb situation, you're protected. So again, you might do that. Keep going, try to get their heart pumping for them until 911 can get there.
Typically, when we think cardiovascular disease, we think, of course, adults. Like you mentioned, children still experience this as well.
Yeah.
And I've noticed a lot of the dummies, typically, we're always dealing with adults.
Yeah.
In babies, is it similar or different?
It is different. It is different. People that are interested in doing infant CPR, I would definitely go take a course on it. They actually create little mannequins that are also baby shaped. But yeah, just hand placement, depth placement, a lot of it is different. It does matter. So I would definitely take the time to look that up and make sure you're doing that correctly. But this is good for like toddlers, adults, young adults, even our elderly, stays the same.
Jordan, with a little bit of time that we have left, again, you mentioned it, but why is it important? Because we have a whole day about it. I'm wearing giant red boots about it. Like, why should we do and keep ourselves knowledgeable about this?
So unfortunately, we see a lot of cardiac arrest outside of a hospital. I think most people are assuming that we're within a hospital setting, right, where we can jump in or we're near someone who else, is going to know how to do it. But what if this is your husband? What if this is your son or daughter? We want everybody in a household to be comfortable seeing that if they have have a loved one, or even just out in public, somebody goes down, we're comfortable approaching and helping. So doing our part to make sure that we give people a better chance outside of the hospital to survive cardiac arrest.
I love it. Jordan, thank you so much. Again, it's all about knowledge and awareness and being ready to step in when you are